Hi, my name is Kate Tipping, and this is a presentation on cystic fibrosis. So we're going to start with questions, find out what you know. Then we are going to move on to what is cystic fibrosis, the symptoms, the pathophysiology, the etiology, clinical examination, and the history as well, so what you'll be looking for in an OSCE, and then the summary, which is the multiple choice questions again, to see that if you've learned anything new or you've retained the information. Okay, so first question. What are the main symptoms of cystic fibrosis? Now, bearing in mind that cystic fibrosis mainly affects the lungs. So would it be difficulty breathing, coughing up mucus, frequent chest infections and sinus infections? Would it be headaches, fever and hepatomegaly? Would it be optic neuritis, abdominal pain or difficulty walking? Or jaundice, shortness of breath and joint pain? Okay, and the answer is difficulty breathing, coughing up mucus, frequent chest infections and sinus infections. Okay, question 2. How is cystic fibrosis usually inherited? Is it autosomal dominant, X-linked dominant, autosomal recessive, or X-linked recessive? Bearing in mind as a clue, if both parents are a cystic fibrosis carrier, the child will have a 25% chance of being born with cystic fibrosis. The answer is autosomal recessive. Question 3. What is the current median predicted survival age for someone with cystic fibrosis? Now, it is just a predicted age. Babies born today with cystic fibrosis can expect to live longer. But the current median predicted survival age, is it 17, 27, 37 or 47? The answer is 47. Okay, so what is cystic fibrosis? Well, it's a mutation of the cystic fibrosis transmembrane conductance regulator gene, CFTR, which is located on chromosome 7. It's a life-threatening disease. It affects the lungs and the digestive system. It does affect other internal organs as well, and it causes them to become clogged with thick mucus. So it's a genetic condition, and it's basically the body's ability to control the movement of salt and water between cells. And 1 in every 2,500 babies born will have cystic fibrosis. And there's around 100,000 people in the world today who are sufferers. And the current median predicted survival age for someone with CF is 47. However, almost half of patients with cystic fibrosis will live past this age, and they'll live a lot longer due to advances in medical treatment. And that, every year, yourself, textbooks go out of date, there's new treatments coming in, and hopefully we can expect to see people living a lot longer. There's no cure for cystic fibrosis, but there are treatments that are available. It's inherited in autosomal recessive manner, so that means that two people who've each got the abnormal gene need to meet and have a child in order for that disease or trait to develop. Now, in the UK, we do have a screening program for cystic fibrosis. So we have the heel prick test. It's usually carried out when the baby's 7 to 10 days old. And they'll take a little drop of blood from the heel. It's sent off to a lab, and they'll test it for, I think there's 9 conditions, maybe less, I'm not sure, but there's a number of conditions, one of them being cystic fibrosis. So symptoms: persistent cough, sometimes with phlegm, salty tasting skin, frequent lung infections, wheezing, shortness of breath. So again, you're thinking about the lungs are very clogged with mucus, and what symptoms would you get if your lungs are impaired? Poor growth in children, difficulty in gaining weight, steatorrhea, so smelly, greasy feces that's difficult to flush. So going back to the poor growth, difficulty in gaining weight, steatorrhea, I will go into more details why that happens, and also infertility. can happen in females as well, but it's always specifically pointed out that because of the vas deferens, those long tubes that the sperm basically travel through, they become blocked with mucus, so they can't get through, so they can't fertilise an egg, they're not going anywhere. Or they can have, the vas deferens can just be absent, known as congenital bilateral absence of the vas deferens. Okay, so as I talked about before, it's caused by a mutation, and it's what's known as the cystic fibrosis transmembrane conductance regulator gene, or CFTR. It's on chromosome 7. The most common mutation is delta F508, which is a deletion of 3 nucleotides. That's probably if you were asked that question, that would be the one that would come up at the top. But over 1,500 other mutations can produce cystic fibrosis. Now the CFTR protein functions as a channel across the membrane of cells, and it transports chloride ions across cell membranes in the chloride channel. So what happens is mucus-secreting cells transport chloride into the secreted mucus. Sodium ions and water follow passively, keeping the mucus moist, because where sodium flows, water goes. So impaired transport out of the cytoplasm creates sticky, viscous mucus secretion in the lungs, the pancreas, and the other organs. So obviously this protein isn't functioning properly, and you're getting this build-up of mucus. And then you've got the airway surface liquid, which is vital for the mucociliary clearance, so sometimes called the mucociliary escalator. It basically gets rid of all that gunk that's in your body. It pushes it up and out, so you can cough it out, get rid of it. This is compromised in cystic fibrosis, so their airway surface liquid is dehydrated, and it means that they're not able to clear gunk and mucus like we can, and instead it stays in their lungs. So here's what happens. You can see in picture B, that's a normal airway. So it's nice and clean. It's it's got a thin layer of mucus. You can see that air could easily get through. There's no problems. Then in picture C, you've got an airway with cystic fibrosis. Now it's widened. There's thick, sticky mucus blocking the airway. There's also blood in the mucus, and there's also bacterial infection, because it's a nice, moist, warm environment. The bacteria love it. Then you get our bodies try to fight it, so they send in loads of neutrophils, and then they end up in there, and it all gets inflamed, which unfortunately makes it a lot worse. So some of the organs that are affected will be, basically it's a whole body thing. You have your sinuses will be infected, your lungs. So again, if you can see from picture C, that's what your bronchi are going to look like. They're going to be full of bacteria, they're going to be sticky, you're not going to be able to breathe properly. Your skin will produce salty sweat. Your liver is then going to be blocked. The biliary ducts will be blocked with mucus. Pancreas is going to be blocked with mucus. The intestines, they can't fully absorb nutrients. So again, you're going to have that problem with poor growth for children. Adults are going to have difficulty gaining weight. And you're going to produce that fatty poo, steatorrhea. And again, as we talked about reproductive organs, there's going to be complications. Now, patients with cystic fibrosis are susceptible to bacterial infections, and there's a list of bacteria there for you to have a read through in your own time. They also, because of the mucus hypersecretion, they have a biofilm formation, so they get lots of bacteria living in that. It's a great environment for them. Then the neutrophils come in and they're like, right, let's get rid of this bacteria. Everywhere gets inflamed, and it's already full of mucus, and now it's inflamed, so you can imagine it's even more difficult to breathe. You start to get structural airway damage, which is known as bronchiectasis. This is irreversible, so it's dilatation of the distal airways, and then that further predisposes cystic fibrosis patients to more infection. eventually the respiratory system is compromised and it does lead to respiratory failure. So if you were to look, you have a cystic fibrosis patient in front of you. Hopefully they will have already had when they were born, they'll have had a newborn heel prick test that would have been picked up. Sweat tests can be carried out. So if they're a little bit older and for whatever reason they didn't have the newborn heel prick test, you can then do a sweat test, and you can look at the levels of sodium and chloride. Chest radiographs will show shadows and they'll show the bronchiectasis. So there'll be exaggerated bronchial markings. You'll have those widened airways, the dilatation. Lung function tests will usually become obstructive as the disease progresses. And as I explained before, the complications of cystic fibrosis can eventually lead to respiratory failure. So if you had a patient in front of you, what would you be asking about? What would you be looking for? They would have difficulty breathing, shortness of breath. So you would expect them to have a persistent cough, signs of cyanosis if they're, having a really bad episode with their lungs. So you'd look for the blue lips, you'd look for the in their mouth and under their tongue. Wheezing on auscultation. You'd have clubbing of the fingernails. If you were doing an ear, nose and throat examination, you may find nasal polyps because of recurrent sinus infections. They have a poor uptake of vitamin D because of that malabsorption, and that can lead to osteoporosis. So you may find that they've got a history of fractures, or they come in wearing a cast because their bones are much weaker. And usually patients with cystic fibrosis are very slim build. They've got difficulty with those digestive enzymes. They're not able to break food down properly. So they're not getting all the nutrients and the fat out of the food. Instead, they're having the steatorrhea, so the fatty poos coming out. So you will find that they do have difficulty gaining weight even when they're eating more than, an average person. So in a child, obviously the impact is that it's poor growth, failure to thrive. In the UK, as I've said before, it's quite rare for an adult to present with cystic fibrosis. So your patients are usually when they're first diagnosed, they're going to be when they're born, or they're very, very young, hopefully, so that then you can manage that, you can have a treatment plan in place, you can support the parents, which is, very important. Having your child diagnosed with cystic fibrosis, I can only imagine that's awful. And so, support the parents, support the child, and support them through, as they go through life, with all the different treatments that are available. So I'm going to whiz through these questions, find out what you've learned. Okay. So what are the main symptoms of cystic fibrosis? And it's difficulty breathing, coughing up mucus, frequent chest infections, and sinus infections. Okay, question 2. How is CF usually inherited? And the answer is autosomal recessive. And the final question, what is the current median predicted survival age for someone with cystic fibrosis? And again, this is just a predicted age. Some of you watching this presentation today may go on to work with cystic fibrosis patients. You may be involved in research. You may discover something that can, hopefully, some of you may discover things that can, prolong life and, do some brilliant work in the field of cystic fibrosis. But the current median age is 47. Okay, and that's it. I'd just like to thank you for watching. And yeah, if you've got any questions, please contact us and we'll get back to you. But thank you.